Hello, my name is Terry Jono. I'm going to do a head and neck assessment today on my son, TJ, and we're going to start now. Of course, before I would go into the room, I would wash my hands, put on gloves, but I don't have those things at the moment. So here we go. I'm walking into the room and I'm letting the patient know that I'm about to do an assessment on his head and his neck. So TJ, I'm about to get started, okay? So right now what I'm doing is I'm going to be feeling his head, and what I'm trying to find is if there are any lesions or abnormalities or malformations. I'm also looking at his hair because that can determine nutritional status, like if it's really brittle and easily breaks. And his head is normocephalic, nothing wrong there. Okay, I'm also going to have you look up. Okay, I'm gonna try to pay attention to if everything is symmetrical: eyes, nose, mouth, eyebrows. I'll palpate his sinuses. Is there any soreness there when I touch you there? No? Okay, I'm also going to pull down his eyelid some because I want to make sure the sclera is white. That's an indication of good health. And the conjunctiva is pink. That's also an indication of good health, which they are. Okay, that's tender. Okay, can you open your mouth for me? Close it. Open it. Okay, and I'm checking to see if this temporomandibular joint is working appropriately. And you're fine. You can close your mouth. I'm going to also feel for lymph nodes, which, if they're swollen, could indicate a tumor or infection. So I want to check these behind the neck, also in front of the ears, right here in this area, in the neck. None of those are swollen, so there's no indication of infection there. I'm also going to listen to his temporal vein to make sure there are no bruits, which are abnormal, and there are not. Okay. So I'm also going to look into his ears. Right now I don't have an otoscope, so I can't use that. But what I want to determine is if his ears are clear, free of drainage, if there's any swelling or redness. I'm also going to move over here and do the other ear. There's no drainage or redness noted. I'm also going to look at the nose, make sure there's no swelling or redness there as well. I'm going to push on the side of his nose and have him blow out of your nose, your nostril. I'm also going to do the other side as well. Blow, please. And that's going to indicate if his nares are patent, if there's any stuffiness or congestion. I'm also going to look in his mouth. So could you open your mouth for me? Okay, and what I'm going to be looking at, I'm going to see if his mucous membranes are moist, and they are. I'm going to check the condition of his teeth because we also want to know his chewing abilities, or if there's any problems with that. I want to look at the tonsils to see if there's any swelling or redness, and there is not. So you're good. Thank you. You can close your mouth. Okay, I'm also going to check to make sure the trachea is midline. And then one at a time, I would check his pulses. You don't want to press them both at the same time because then you would obstruct oxygen to the brain. So from behind, I'm going to come over here. I'm going to lightly push, and I'm going to palpate right here to make sure that he has no swelling or anything in his thyroid gland, that there's no enlargement, and there's not. Okay, so now we're going to do an eye test. let's see, his pupils right now, I would say, if I had to guesstimate, we're about 4 millimeters. And what we're trying to determine is if they're reactive to light and accommodation. They are equal in size. If they were not, it might make you question if there were some neurological problems or increased intraocular pressure. So, I'm going to shine my light, if I can figure it out, into his eyes. Okay, I'm going to come over from this side, and I want to see if his pupils dilate. Okay, and TJ, I want you to stare at a fixed point over on the wall. Okay, and then come, now look here. And what I'm checking for now is accommodation to see if his eyes accommodate for looking at distances and also objects that are close up. Now, I'm going to have you hold this paper over one eye. And with my pen, I'll be moving it. And as I'm moving it, watch the pen, because I'm checking your peripheral vision at this moment. Okay, you can change it to the other side. I'm going to move it. And if you'll follow the pen, we're making sure those muscles are working in your eyes and that you have good peripheral vision. Okay. Very good, thank you. Okay, I'm also going to take the pen, and what I want you to do is I want you to follow the pen with your eyes as I move it, okay? Okay, good job. You're doing good. Okay. Also, what I'm going to do is check your hearing. They have certain tools that you can use, and if I had a Snellen chart, which is an eye chart, I would have also used it to help determine visual acuity and how well he sees at distances, but I do not. And as far as hearing, they have certain tools you can use to help you assess hearing. But the tool I'm going to use now is the whisper test. I'm going to cover one ear, and I'm going to whisper kind of behind him where he can't see my lips and ask him to repeat what I said. Could you repeat what I said?
Good boy.
That's what I said. Good job. Okay, we're going to do the other side. You can't see me. I love you very much. What did I just say?
Love you very much.
That's very good. That's exactly what I said. Okay, and the reason that we assess these things is, we're trying to establish the health of the individual. And besides the head, we also want to palpate all through here just to make sure there are no lumps or abnormalities. We also want to assess their range of motion in the neck and the head. So what I want you to do is I want you to put your chin to your chest. Okay, and then I want you to tip your head back. Then I want you to bring your cheek over to your shoulder, to one side. Then I want you to bring it over to the other side just the same way. Very good. Okay, you can straighten up now. So what we've assessed is we've assessed the head. We've assessed the temporal veins. We've assessed all of the lymph nodes in the area, behind the ears, the neck, in front of the ears. We've assessed any soreness or problems with sinuses. We've assessed the color of the eyes and the conjunctiva. We've assessed the nose, the nares. We wanted to check patency for drainage or swelling. We've assessed the mouth. That would include the teeth, the throat, the tongue, the color of the tongue, and the mucous membranes. And we've also assessed that the trachea is midline, and we assessed to see if there was any swelling in the thyroid gland. We assessed movement. We assessed PERLA, which is, the pupils are equal. They're reactive to light and accommodation. We assessed hearing as well. And that about sums it up. So thank you very much.